I have no other cards. Did anyone else wish to speak on this item? You never know what you're going to get. It's like a box of chocolates. So now we're debating Obamacare here at the county level. And Mrs. Brown, I do agree with you on one point that you said. I do want to ask our council to look at the liability issue she brought up in terms of navigators. I think that's a valid point. But on everything else, you know, to me, I don't see how getting more of our residents educated on their medical options is a bad thing at all. And you talked about us circumventing the legislature. Well, Governor Scott changed his mind on Medicaid expansion, and so did the Senate. So really, the only folks that stood in the way of that were a few people in the House. So let me just say, we're not going to fight the Obamacare battle here at 315 Court Street. In my view, we've seen the economic impact of poverty. We know we have many folks that don't have access to health care, and at the end of the day, we're paying for that. I didn't interrupt you for 10 minutes, Mrs. Brown. Let me go on. So I fully support this, the fact that we have $600,000 to apply to this effort, that we've built partnerships to get these access points, that we've got a good plan in place. I'm fully supportive of this, and I hope this board approves it. Comments or motion from the board? Commissioner Long?
Yes, I haven't really had time to summarize all of my thoughts to Mrs. Brown's comments, but knowing more than I should about the issue of insurance and licensing and all of that, I am really confident in one thing. This is an enormous undertaking for thousands upon thousands upon thousands of people, not only here in Pinellas, but throughout our state and across our nation. And like any other really big, huge effort, no matter if it's at the federal level, the state level, the county level, or the city level, big ideas take bold action and leadership. And you know when you go forward that there are going to have to be tweaks and things that get worked out, because it's almost impossible to get it 100,000% right the very first time. So the one thing we do know very confidently is none of us in any of our communities can afford the enormous cost of the uninsured. And this is an effort to try to get a handle on that, to improve the quality of people's lives. Are there going to be a few blips? Are we going to make a few mistakes? Like you said, Mrs. Brown, it's human nature. People do make mistakes. That's why most of these people, I feel quite certain, just like you probably, will have E&O coverage in their homeowner's policy, and they'll be able to find those issues. I'm going to leave it to our county attorney to find a solid answer for that issue. But I, like our chairman, am extremely supportive of going forward, because it's going to help our citizens, and that's what we're here for. And so I commend the staff for the amount of work that they've done to try to put this together, and I know it's going to be a hard journey, but I'm very confident that we're going to get there successfully for the benefit of all of our citizens, and that's what matters to me.
Thank you, Commissioner Long. Commissioner Maroney?
Thank you. Just explain to me, as a state that has refused Obamacare from being part of it here, why are the feds offering $600,000 to a county in a state that doesn't want to be part of it? But we're the only county.
We use the money.
Right.
So we get to fund it ourselves.
But
Ms. Warren?
My understanding.
Dr.
Warren, it's so nice to see you again.
I'm so proud of the graduation.
We're proud of you too. Wish I could have been there.
Commissioner, the issue that the state dealt with on Affordable Care Act last year during my session had to do would each state has the ability to accept or not accept a new group of eligible Medicaid individuals. The law basically provided for you the public or private health care for everyone, everybody had to register. But there traditionally and historically has been a group of individuals that are not eligible for Medicaid who live in the poverty zone. And that group happens to be the same individuals that this commission pays health care for under the Pinellas County Health Program. So our desire, and I think was that if the state had accepted the newly eligible population, which they had a choice to, yes or no, some states chose to, some not, and ours didn't initially chose not to, that would have insured about 128,000 folks who are uninsured and are not eligible for Medicaid. Under the law, the state could have made them eligible and the federal government would have paid for the lion's share of it. But they opted not to for whatever reasons. And so where we're at now is we have a group of individuals, close to 100,000, a little bit less than that, who are in fact eligible for Medicaid who never enrolled. They either go without insurance, did not know they were eligible, or were on private insurance but are actually eligible folks. So that is the new group based on the law. When everybody, every employer and every insurance company starts looking at their enrollees, they're going to see whether or not people can be enrolled under the federal health care program versus a private insurance. So those are the people we're capturing now. At some point, hopefully, we will capture the uninsured, which we cover. So the state never made a decision about accepting or not accepting Obamacare. The Affordable Care Act. What they decided is that they weren't going to accept this newly defined population, and they weren't going to accept the federal money to cover them. That's all they were doing. The federal law is the federal law. The state does participate in the implementation of the exchanges. We'll provide the health care options and regulate it in this state for everybody who is eligible. That population at this point is not, and therefore we provide the coverage.
Thank you for clarifying that. It's not an easy thing to absorb.
I don't know if I did it easy.
No, you did, because you went through it twice. The other thing, I agree with you, Mr. Chairman, Mrs. Brown's on the right track with the liability. As a former life insurance agent back in my early days, I know that there was liability affiliated with that. But she also brought up about to make sure that that client would be exposed to all the products that are on the market. How are these navigators going to do that, and are they doing that now? Like if another state is doing this, are they giving all those other products?
The states have to have their exchanges up by October 1. In the law, it requires that they have a minimum of 2 to 3 insurance companies that agree to participate. So the state is the ones who are responsible for setting up the exchange, negotiating the cost rates, and providing marketing material. What we will be doing is once they have their exchanges set up and what kind of insurance each exchange will offer, so based on a certain age group, health conditions, etc., there'll be a price for a higher level insurance, medium level insurance, and basic insurance. And so they'll put the actuarial table together, so there'll be 2 or 3 insurance companies out there. They'll have a list of what you get based on your age and your demographics, and then they'll have a cost assigned. Additionally, for people who are currently employed who choose to stay on their employer's insurance or not, go to one of these other insurance, they'll be telling them what the difference is and what the minimums that they have to have. Probably the other complicated issue is that individuals who are required to have insurance but fall at a certain income level will receive a tax credit in order to assist them in buying that insurance. So for the purposes of the Navigator or our referral, these are not individuals who sign up for anything. These are people who sat down with our average client and will sit down with them and their families, explain that when you have to be enrolled, if you can't afford it, you can file under for your taxes, so give this information that's going to be generated by a state computer to your tax person, so that they can assist you in getting your credit. But if you choose to enroll and you can afford it, there's 3 companies, they have 3 policies, they have 3 policies, they have 3 policies. This is what they offer. These are the cards. And so when you go to the official to enroll, if you're not sure of how to do that, this is the information you'll need to talk to about your family so you can select. So our role in the Navigators at 30,000 are not enrolling people in insurance. They're going over the minimum requirements and the options.
Well, they would need a license to, if they were putting people in. Right.
That's why they call them Navigators and not insurance agents.
So, all right, thanks. And just a comment to Mrs. Brown. Thank you, Gwen. I don't know if you're aware of our policy, but if you send a question that we're going to get an answer from staff, all 7 of us get it. The chairman, and that's why he replied to you. He handles that because, or else you would have 7 commissioners asking the same person the same question. So that's why you didn't receive a personal.
I concluded that when I got it from him, but I
Okay.
just never.
Okay, well, you said I didn't
got
answer your email, and I answered
No,
a
you
personal.
did. You said
Yeah.
you give it the answers as
So,
soon as possible.
Anything we pull up, we're not pulling fast overnight. So thank you.
Thank you, Commissioner Roney. Commissioner Roach?
Thank you, Mr. Chairman. I've got some concerns over the liability particularly, and that's kind of one of the reasons why I asked what our deadline was. Do we have time to get that answer before we go forward on it? But I did have a couple of questions on it. Did I hear a $10 million grant and a $4 million grant has already been
100
issued?
million.
I get the gentleman.
I'm sorry, the question.
Did I hear you state that a $10 million grant and a $4 million grant had already been issued in this area?
No, sir. Enroll America, which is a national organization, has received nationally a $100 million grant for the entire country. Within the Tampa Bay area, on a separate program, the University of South Florida has received a little more than $4 million for a variety of things, including child health care, but also Navigators. That represents more than 50% of the state of Florida's $8 million. So my point was that there are a number of programs and grants in the Tampa Bay area.
Already there, right. Okay, all right, thank you, appreciate that. My question next would be, who created this abstract and marketing plan?
My staff.
Okay, your staff?
Yes, sir.
Okay. Any input from our marketing people on this? Or do you have marketing people on
I'm sure
staff?
Natalie talked to them, but
I tell you what, we have a current contract with temporary services through our human resources department. This is what concerns me about this is the staffing. It's a $600,000 grant to help educate people, but 450 of it are going for hiring people. Not necessarily, I think our role here is one of information disbursement on the concept. I agree with Commissioner Welch, I didn't debate Obamacare as validity or issue here, nor should we engage in, but for that same reason, in my opinion. However, our role could be one of information dissemination. The liability issue does give me question. I'm not really thinking it's best practice for us to hire 15 people and fire them in a year for a temporary role. I'm wondering if not this could be worked out through our existing contract for temporary services, folks who might already be trained, and not necessarily require the training and the supervision and that cost. Goal being, I think there might be a better way to divert more of these funds into a marketing program, which I think is the role we should have here, as opposed to coordinator role. And I'd like to see the marketing department come up with the best plan. I look at several of these, and I spent some time in marketing, and the three of them, although they're under different names and titles, it's all the same company. It's all going to the same people. TampaBay.com, Tampa Bay Times, Tampa Bay newspaper, that's all the Times. It's not, we call it, So, and how many folks we're looking to reach are actually getting a subscription to the Times? How many folks we're looking to reach have a Facebook account or even a computer to go on a Facebook account, or an internet account, or the Gazette, or a billboard, or a brochure? I thought I heard you say the state was going to take care of the marketing, so that some of it. So I'm wondering I'm wondering if we can take a break on this one or defer this one so that we can get the liability questions answered and reconsider exactly how we're appropriating these funds to get our best bang for the buck and what our proper role is.
Thank you.
And it's in my opinion. I'm not challenging the role or something. I'm saying I think our role might be better off as sort of a pass-through for information dissemination as opposed to actual.
Just a point of clarification. The individuals being hired are being hired by the state health department. They're not being hired by the county. The reason we're doing that is because of the wage difference. And also, they have a ready workforce and client group who works and lives in the community. And what we're attempting to do, our major role is obviously to get the information out, but to make sure those people who are being served by the health department, JWD, MS, and the health clinics, that we screen them and see if they're eligible for other insurance. So the liability issue would be a liability issue for the state, not for the county. We're not hiring anyone. The reason why we're relying on the state is because they have temporary employees who are bicultural, bilingual, and who live throughout the county and are available for high school. We do not as a county. And a private agency can't do this for us.
If this is all by the state, then why are we even involved?
Yeah.
Amen.
The applicant
Please, folks, don't yell out.
We're the applicant and the coordinator for all of the agencies, and we were requested to participate in the program because we're a qualified federal health center, and we are very interested in participating in the program because we fund indigent health care in the county, and we felt that it would be to our advantage to transfer as many folks as we could to Medicaid.
No,
Because we have a vested interest.
I follow that. I'm not challenging. I'm trying to put the departments. The way I'm reading this, I'm seeing the department did this and this department. So when I see the department, is that you?
The department is us.
Okay, so
And we
the
represent
department
the
is seeking approval to subcontract with the Florida Department of Health in Pinellas County to recruit, hire, train, supervise health exchange navigators and this thing. So are we doing it or is the state doing it? I'm confused now.
I'm sorry. I didn't mean to-
That's all right. No, I'm looking at it.
The question was the
We're saying that the
navigators.
health coverage exchange will provide up to 15 navigators that you're saying the state is hiring these people, not us? We're not even involved in the hiring?
The navigational program under the Affordable Care Act is managed through the state. The monies available to assist communities in assisting, especially low-income folks, in enrolling in the program is handled by the federal government. So the federal government put out a request for application and said those people who have the most exposure to people who are marginally unemployed or unemployed or underinsured, we would like for you to apply for this grant to assist. Additional credit will be given where you have collaboration and partnerships because we want to make this as broad as possible. Our agency, our county, was selected for two things. The county funds indigent health care. That makes us really unique because most people don't. They have other sources of funds that does that. And additionally, we're a federally qualified health center. So both lists we were on immediately. We got referrals from a variety of individuals in the community requesting that the application.
Well, I understand, I don't want to cut you off, but I understand, we've already been through that. My question
The
is,
Navigator.
who's hiring these people?
The health department, the county, Pinellas
Pinellas County
Health Department.
is
If
funding.
you
So
allow
not the state.
us to
It's
accept
just the
it,
state funding for those certificates.
Which is a state agency.
which is a state agency, and every agency that's partnering are going to manage those folks stationed in their agencies. So all of the community, the family success centers will have a navigator. The manager of those centers will be that person's supervisor to counsel their clients when they come in. All of our medical homes will have one. It'll be the supervisor who makes sure they get the referrals. And then we have a countywide coordination team that makes sure that everybody gets their quarterly training and update. They have to have their certification before they're posted out. And then we have what we do in government, collect paper. So we've got to report all of this. And so that will also be done through the, I'm sorry about that.
Did that answer your question, Commissioner Roach? We've got some other commissioner questions on this side.
Not real, I'm sorry to say it, but it's educating.
No,
What I'm trying to find out is who's in control of this, because I'm hearing the state and I'm hearing you. Who decided how many people we will hire? Who said 15?
Well, the first thing we did when we got the grant, we called all our partner agencies, which is a part of our process.
Just one
and
thing,
said,
who
Let
said-
me take a shot at this, if I
We
if you
planned
will.
it together.
Don't need-
Let me take a shot at this. The grantee is Pinellas County. The operator of and overseer of the employees is the state agency. We will subcontract with them. Subcontract is moving a piece of this to them.
I
Is
said,
that-
who said hire 15 people?
We
Right there's
develop,
the question.
we develop the grant program and the parameters for the program. We did.
The responsible party.
Pinellas County did.
That's, I apologize, it's frustrating, that's 10 minutes.
Pinellas County staff.
Okay, perfect. Pinellas County said hire the 15. We determined it's 15, right? So we
I
can-
just said that, yes.
Correct, so we can determine it's 10
The
and
basis-
reallocate that dollar. I'm trying to find where I'm hearing.
We can-
I'm hearing we have
we-
control, but we have no control. I'm just
We
trying
can
to-
structure this program within the broad guidelines of the funding agency, which is the federal government.
Okay, so we do have that ability.
So long as we meet their outcomes and results,
Okay, so the
as
flexi-
outlined in their parameters.
Okay, so we have flexibility within that. These weren't state guidelines that we were
No, they didn't
following
say
with
hire
respect to
15.
these dollars amount.
They didn't say hire 15.
Okay, nor did they say 12,375 for marketing. Correct. We made those calls.
That's correct.
All right, that's where I'm, that's just, there's nothing built in that, they're very straight quick.
Got it.
That's all they are, so that I can get to a, position. Thank you, Mr. Chairman, I appreciate it.
Thank you, Commissioner
I
Roach.
appreciate your patience on that.
Sure thing. Commissioner Long?
Thank you, I was just writing my question down because I was gonna forget it, it was going right out of my mind. I apologize. But maybe this will help you, Commissioner Roach, a little bit, my question. I would just like to know if, I do agree with one piece back about a half hour ago that Commissioner Roach said with regard to out of a $600,000 grant, is there a possibility to reallocate a portion of that to do more advertising / marketing, whatever you want to call it? Because it does seem to me to be a pretty minimal amount that we're going to spend to get the big, broad message out there in the community. And truthfully, that's what the whole money is for, right, is to educate?
Sort of. This is a national program, and when we wrote the proposal along with our partners, the decision was made that based on our client loads, which we know, and their family members and the communities that we're going to target, it was more important that we be able to spend time with people talking them through this. We're looking at some 16,000 people in 9 months to get them registered. It is not a lot of time, and we don't have enough people. Because if you look at the thousands of folks that we're going to try to get this information to, make sure they make a decision so that there's no financial penalties, and also aid the county in making sure everybody who's in one of our programs gets transferred to a legitimate insurance company if they qualify for it. To do that, it's a large task. So
I agree.
15 people and 16,000 applicants with cultural and other issues. The staff is small given the task. Not they're dedicated, but this is not an easy task. The other thing that we counted on, which is why our group is the partnership is what it is, between the health department, JWB, our agency, and the health clinics, the free clinics, and the college, we are the lion's share of the health providers. Many health centers got their own brand.
And
So,
USF, I heard,
well,
USF got
theirs is for the state. They do statewide as well as a part of the county, but they're the statewide firm that's going to be doing this, however they are going to do it. So this is focused on Pinellas County only. We wanted to believe that it was really necessary for the family success home, the medical homes, the health department clients, that we be able to provide this service to them and complement to what we're already doing. And so 15,000 new positions or 16,000 clients, that is not a lot of staff, trust me, in any way or imaginable for the word. And the market group is basically us. We're the larger agencies who either fund or provide healthcare.
Let me add something to this, Gwendolyn,
I'm sorry.
if I may. No, don't be sorry. Our clients are largely uninsured. We have this captive group that we can help enroll as opposed to reaching out for others. We'll get those enrolled. We are doing outreach and we will get others. But if you're going to make a choice between attracting a lot of people to come and enroll in a very difficult process and have nobody to help them, or very few to help them, versus a existing pool of uninsured that we can get enrolled, the return on investment of those dollars will be far greater in terms of shifting people off of our tab onto Medicaid. So I think this has been thought out pretty carefully, and appreciate the input from a variety of folks. But I think we've got a program that was not just thrown together.
Thank you, Bob. Thank you, Commissioner. Commissioner Seal?
I move approval, and I'm going to make my comment, which is, if we were, first of all, the health department, if they're hiring the employees, I would imagine the liability is going to reside with them, correct?
Yes.
Okay. Second thing is, if we were worried about liability, then we shouldn't be having our county medical plan that we have now. We have navigators now. We have case managers now.
Thank you.
We have contracts with medical providers and hospitals now. So I think Mr. LaSala has hit it square on.
Yeah, you have 20,000
It's going to save
claims
our
tonight.
taxpayers here some money by shifting it to Medicaid. And that's the end of my comment.
Thank you,
That
Commissioner
was
Seal.
That was beautiful.
The motion was Commissioner Seal, the second was Commissioner Long.
Yes.
Okay. Commissioner Justice.
Thank you, Mr. Chairman. And I'll just say I have a feeling if we had a $100,000 advertising budget in there, we'd be coming back arguing about that we're spending too much on advertising and not enough about communicating the service. The actual Navigator, the person, the human person there, reaching the people as Bob was talking about, it's a special market. It's not someone driving by reading a billboard necessarily. It's not selling a Coke. It is special services. And correct me if I'm wrong, but the idea is that when we're done with this, and we enroll thousands more people into Medicaid that are now not in any kind of coverage, not because they didn't know about, they didn't choose between that and a Humana, they just can't afford it, that they're going to actually get health care through a Medicaid or an insurance program, and not going to get their basic care in an ER, which costs us a lot more money.
Thank you.
Well said. All right, we have a motion and a second. Commissioner Roach.
Thank you, Mr. Chairman. And Karen, your comments are excellent, well done, well stated. But I did have a question. I think it's great in terms of it saving us money. How much? Does anybody know?
Well, if you were to calculate, and
just
this
wasn't
is,
here,
this would be a theoretical
I
exercise.
understand.
You would take, what is the average or typical cost of a person who we are treating during the course of a year, and we shift them off of our ledger sheet onto Medicaid. So I don't know the answer to that.
If
Do
we
you
hit
care
our
to
goal-
speculate?
If we hit our goal of 16,000, that was your goal, right?
That's our vote.
What would that, if we hit it, what would that save our citizens? Under our current per client cost ratio now?
The chairman is the finance guy, but I would give you these numbers. In the uninsured individuals who use the emergency rooms who have no insurance, in this community, it costs you $1 billion a year. For those individuals, if they're receiving health care, they use emergency rooms, half that of regularly insured people. So the cost of uninsured health care in our medical system, whether it is, if you include the unreimbursed amounts from Medicaid, and if you include indigent health care, it's $2 billion.
2 billion
$2 billion would it be
every year
every year.
in this county?
In this county,
This county
documented by the state.
General fund
And
pays
approved by.
for?
No, that includes what the
That's
hospital.
the citizens, the hospitals, and the community absorbs.
Do we have, and this will just end it up just for my numbers, do we have a figure of what it costs annually for us to care for our
Per
needs?
capita?
It's about $1,200
Okay.
for those
So in
clients
effect, the answer would
enrolled.
have been 16,000 times $1,200 if we hit our goal, is what we may say. I know it's rough, is that what you're,
Okay,
is that correct? I mean, that's about 1,200?
it's about $1,200 for each client that we're serving annually. Give or take a hundred.
That's what's rough. Yeah, it's a roundabout way, and I do apologize, I'm trying to be as direct as possible, but if we can get right to the numbers, what that answer is. Thank you, Mr. Chairman.
Thank you, Commissioner Roach. All in favor?
Aye.
Opposed? Motion passes unanimously.